Hello guys, and welcome again to my YouTube channel. In this video I am going to take the next topic of your gynecology of third year BMS, which is endometriosis and adenomyosis. So let's begin. First point is endometriosis and its definition. इसको गर्भाशय अंतकला अस्थानता भी कहते हैं. So let's see the definition of endometriosis. So presence of functioning endometrium in the site other than uterine mucosa is called endometriosis. यानी कि कार्यकारी गर्भाशयिक अंतरकला का अपने स्वाभाविक स्थान से अतिरिक्त स्थान पर पाया जाना ही गर्भाशयिक अंतकला अस्थानता है. ठीक है. Next is adenomyosis. Let's see the definition. If these ectopic endometrial tissues are found in the myometrium, then it is termed as endometriosis interior or adenomyosis. यानी कि गर्भाशय अंतकला जब गर्भाशय के मांसपेशी स्तर में प्रविष्ट हो जाए उसे अंत अस्थानता भी कहते हैं. ठीक है. Next is sites of endometrium, which means these are the sites where the endometriosis usually happens. Which are they? Abdominal, extra abdominal and remote. Abdominal यानी कि औदरीय, extra abdominal यानी कि बाह्य उदरीय और remote यानी कि दूरस्थ. So first is abdominal यानी कि औदरीय. So it is usually confined to the abdominal structure below the level of umbilicus. So the abdominal type of endometriosis is usually found in the abdominal part which is below the level of umbilicus. Okay. So which are these part which parts are included in the abdominal part of endometriosis are these are ovary, pouch of Douglas, uterosacral ligament and broad ligament. Okay. Next is extra abdominal. So hysterectomy or hysterectomy scar which is formed during the removal of uterus. So extra abdominal in the extra abdominal part we are seeing hysterectomy scar. So during the hysterectomy, if some scar happens, then there are chances of forming endometriosis in the near future. So next is Caesarean section scar. So the scar which is formed during the Caesarean the scar which is formed during the Caesarean is called as a Caesarean section scar, and this leads to extra abdominal endometriosis. Third is tubectomy and myomectomy scar. Fourth is episiotomy scar, यानी कि the scar which is formed during the first parturition. In some cases, not in all cases, sometimes a scar is formed or any injury is formed during the parturition or delivery of a BB, which leads to extra abdominal endometriosis. Fourth is when the endometriosis forms in the vagina or in the cervix, then it is termed as then it is termed as endometriosis of vagina and endometriosis of cervix. Okay. Third, so let's see the symptoms of endometriosis. So first point is about 25% of patients of endometriosis have no symptoms. Okay, so about 25% of patients which suffer from endometriosis usually show no symptoms. Their symptoms are usually dormant in them, or they are carrier. Second point is dysmenorrhea, यानी कि पृष्ठार्थम. About 70% of patients of endometriosis usually suffer from dysmenorrhea. It is further divided into primary and secondary dysmenorrhea. Third is dyspareunia, यानी कि मैथुन कृच्छता. It is mostly found in the endometriosis of rectovaginal septum or pouch of Douglas. If endometriosis is found or it is formed on the rectovaginal pouch or pouch of Douglas, the symptom which is showed is dyspareunia. Okay. Next is infertility. About 40 to 50% patients with endometriosis usually suffer from infertility. So about the 40 to 50% of patients who have who suffer from endometriosis usually show symptoms like infertility and abnormal menstruation, chronic pelvic pain, and abdominal pain. Let's see some other symptoms. Symptoms of urinary system, which is बार बार मूत्र की प्रवृत्ति होना और हेमाचूरिया यानी कि ब्लड इन यूरिन. सेकंड इज मलाशयगत लक्षण, विच आर दे प्रेजेंस ऑफ एंडोमेट्रियोसिस. और मलाशयगत लक्षण किस में होते हैं? अगर प्रेजेंस ऑफ एंडोमेट्रियोसिस ऑन द सिग्माइड कॉलन ऑफ रेक्टम, देन वी सी फॉलोइंग सिम्टम्स, विच आर दे डायरिया, डिस्चेजिया यानी पेनफुल डेफिकेशन और एंड रेक्टल ब्लीडिंग. Okay, this is it. This was a short introductory part of the endometriosis and adenomyosis. In the next lecture or next video, we'll see diagnosis and examination of endometriosis and adenomyosis.